What exercises to help and what exercises to avoid with scoliosis. When we look at exercise for scoliosis, there's a very big difference between general exercises and scoliosis-specific exercises, something that we call SSEs. SSEs are designed specifically for scoliosis in mind, which we'll talk about in a second. But general exercises can help with maintaining general health and wellness. But we know general exercise, general fitness will not help correct or reduce a scoliosis. Now, some patients with scoliosis may find some benefit, meaning maybe some pain relief or some overall health benefit by doing general exercises or being generally fit. But unfortunately, I see lots of patients that are very fit and their curves still progress. In fact, my average adolescent case is a dancer or gymnast that's very fit, a 13, 14-year-old girl that looks very fit, and their curves are still progressing. So it has to do with fitness that stops scoliosis progression. When we look at scoliosis-specific exercises, these are exercises that are designed for the patient's scoliosis in mind, and they're designed to put a patient into a corrected position for their specific scoliosis. And they can be very powerful, and they can help augment corrective results used in a treatment program to help reduce and manage the progressive nature of scoliosis. Now, how can SSEs do this? Well, first of all, there's not one form of treatment on its own that can impact scoliosis on every level, meaning on the structural level, on a deformity level, on a strength level, and on a flexibility level. But we know scoliosis-specific exercises, or SSEs, can help increase core strength at the area of the scoliosis itself. And normally these exercises are done in an asymmetrical way and are putting patients into an asymmetrical position to help address the strained muscles and weak muscles and especially the imbalance that's associated in scoliosis. Having strong abs or a strong low back or strong lats or strong shoulders symmetrically doesn't really prevent a scoliosis from progressing. In fact, I can actually argue that strengthening your body around your current scoliosis, it's actually strengthening the scoliosis deformity. We want to put you into a corrected position and then strengthen the spine in this position. And this is where scoliosis-specific exercises can have a greater effect on these muscles and on the flexibility that are associated with your scoliosis. Certain scoliosis-specific exercises are known to stimulate specific areas of the brain and include this brain-body relationship and help involved with postural remodeling and improve body positioning and improved body awareness. One thing we see with scoliosis patients, there's a lack of awareness of what symmetrical is. So learning the right alignment relative to the person's head, torso, and pelvis is something that has to be learned, and scoliosis-specific exercises can help teach that, where general exercises really don't. So what types of exercises should be avoided with people with scoliosis? Well, we know any exercises that overuses one side of the body relative to the other, that it's not taking into account the person's specific asymmetry or scoliosis, could have a negative effect on that person's scoliosis. Exercises that keep the neck bent forward, that increase weight of the head in the cervical spine, cause something forward head posture, which can lead to more a positioning of the scoliosis. Anything that exposes the spine to repetitive jarring forces like compressive forces, like jumping, compression, horseback riding. Exercises that also involve hyperextension of the torso. This is like back bends or extension of the upper spine. We believe can have a negative effect on scoliosis. Well, if we know what can have a negative effect, well, what are things that can have a positive effect on scoliosis? Well, like I said, we know that there's no form of exercises that should be adopted to help treat scoliosis on its own. And more importantly, no form of exercise should be adopted until you consult your scoliosis treatment provider who's helping you focus on reducing your scoliosis. But generally, hip flexion stretch can help open up the hips and keep the hips loose. We know that most scoliosis cases have their hip flexor muscle or psoas muscle has a lot of asymmetry in it that could help. Child's pose or anything that can help lengthen the spine, help keep the spine long, could help scoliosis compression over time. So this long lengthening, Pelvic tilt exercise. A lot of scoliosis patients could have either pelvic flexion or pelvic extension. So we know getting the pelvic tilted into a more neutral position can help relax the lower back muscles and help keep the spine in a better alignment. The latissimus dorsi stretch, we know it's the largest muscle of the upper body. This can also be negatively affected in scoliosis. So stretching these and keeping them flexible will allow the spine to respond better to conservative treatment. And abdominal press helps strengthen the core muscles for spinal support. But again, like I mentioned, just having a strong core doesn't necessarily mean you're going to stop your curve from progressing. We see patients with very strong core muscles and their curves still progress. So the way you effectively treat scoliosis is more than just using general exercise. I like to call the entire approach a conservative chiropractic-centered treatment that integrates multiple treatment disciplines so the condition is impacted on many levels: structural, functional, flexibility, alignment, and strength. We have to look at all of these things because they're all important. So when patients try conservative treatment, a lot of times they'll try one of the five or one thing and they're missing all these other things and they'll say conservative treatment doesn't work. Well, it's kind of like baking a cake. In order to make a cake, you need more than just water. You need water and flour, and you need eggs, right? You need or milk, water, flour, and eggs. You need all those things to bake a cake. You can't just use one and get a cake. So it's the same thing with this type of treatment program. We need all the ingredients, and they have to be mixed and coordinated in a way that's going to work for that patient. So this first thing is the chiropractic care that we use, and this is help adjust the spine and move the spine into a more closer position, but really start dealing with the condition on the structural level and a flexibility level. So specific structural level chiropractic. We use different types of therapies, and we also use therapies that are SSEs that are passive and SSEs that are active. So we use very specific therapy that's scoliosis-specific to help push the spine into a more symmetrical corrected position. And then we use active type of SSEs to help strengthen the body in a more corrected position. And these are normally asymmetrical exercises that are done specific for that presentation of scoliosis. We also will use something called corrective bracing, and corrective bracing helps augment these last two therapies to help push the spine into a more corrected position and help improve body symmetry and help remold the body into a more corrected position. And then last thing is that we take all those programs and we say, okay, out of this, what's the customized home therapy program that the person can do to help sustain long-term results and help hold that spine in that new corrected position. So you notice the one thing that was common with all those things, it's corrected position. If we're not getting you into a corrected position, or whatever you've been prescribed is not getting you into this corrected position, the treatment is ineffective. The hallmark of an effective conservative treatment program is correction, meaning it has to demonstrate while you're performing the activity, it is correcting the scoliosis at some level. Like I said, not one form of treatment or exercise can impact scoliosis at every level. We know scoliosis is a complex problem that necessitates a customized program that's going to use many, many treatment options that's going to provide an effective result. And here at Scoliosis Reduction Center, we offer a proactive conservative treatment program that integrates all these multiple treatments into one program under one roof. And none of the care is fragmented. It's very coordinated to deliver the very best potential results for you. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.